Morning, everyone. It's probably fair to say that in terms of like importance of policies, Keir Starmer says his top priority is the economy, and that's also voters' highest priority. And the reason for that is obviously when the economy is doing well, generally speaking, more people tend to do feel better themselves. More money in their pockets is ideally the idea. But also, they understand that it helps everything else. If the economy is stronger, then tax revenues are up, which means more funding for the other things that people also think are important. But second on the list is always the NHS. And again, there's a good reason for this. Sometimes, voters downplay things that are really important and upplay, I suppose, things that are less important. But on this, voters are absolutely right, because healthcare, of course, is also essential to the economy. If if you've got a worker that is ill or injured and they don't get quick treatment, well, they're not getting back to work. In fact, it's quite weird to me that Conservatives just don't understand the need for effective universal healthcare that will get you treatment quickly and effectively. It's no good just like quickly being given something that doesn't actually fix the problem. So quickly and effectively, because then it gets those workers back. And also, if you treat things more quickly, you have fewer complications, which also then have to be treated. So, and Conservatives also have this anti-immigration thing as well. It's like, well, how does this make sense? Because you want to deprive people of decent healthcare, which means people getting ill and injured are more likely, but also they're not going to be able to then work as well or at all. Where are you going to, who's going to do the jobs then if you don't also like immigration? Anyway. So there's a big report come out. It's come out today. It's by our Darzi, who is in quite an interesting position, because one of the best things I would say about him writing this report is, first of all, he's a doctor, which is useful. But I wouldn't necessarily go, oh, a doctor is the sort of person that should lead this report. But he's also a politician, as in he's in the House of Lords at the moment, but he was a health minister under the previous Labour government. And that's quite a useful combination of things, because if Labour had just commissioned someone to do a report who was perfectly well qualified, eminently qualified, they'd do a really good job of it, they'd identify all the issues wrong with the NHS, and they would say, oh, you need to fix this, this, and this. And then what would happen is you'd have all these recommendations. Labour, the Treasury would work out the bill for it, and they'd go, yeah, no. So because this guy's also a politician, and a Labour politician, he's sort of been willing to work under realistic constraints. So what we've ended up with, hopefully, say he's a surgeon, not a doctor. Doctor. I know surgeons are mental, right? I know that they go through this process of training for years to become a doctor, and then they train for even more years and pass even harder exams so they can go back to being Mr. or Mrs. again. It is but they're still doctors, right? Medical practitioners, healers of the sick. But there we go. For some mad reason, and I'm sure there is a reason, but I doubt it's a good one, surgeons, go through this grueling process of removing their sort of accolade, which has always been mental to me. But anyway, he's a doctor and also a politician, and that's useful because it's allowed him to come up with a report that the government will actually be able to use. And there is a focus in it. I don't know how many people have read any of it, because obviously it's only just come out and it's like 163 pages. I've read some sections of it. The first section I read was on the funding, because that's the key thing, isn't it? It's like you can solve, like people's instinct is always, if you need to make something better, it needs more funding. And it's like, that will always work. That will always work if you can give something more funding. But at the same time, Labour are going, but there's not going to be a lot of extra funding. So it's really a case of how do we reapportion it? And there is always a case for that. I'm going to point out where there's going to be where there are problems in the NHS that to my mind, you could fix relatively cheaply. I don't know how quick, but relatively cheaply. I always go through this sort of we'll always go through our own personal examples of where the NHS is really inefficient. When David Cameron came to power, one of the things he did in that first term was to break up the NHS and make it compete with itself. It's like this Tory idea. Oh, they'll compete with each other, they'll get stronger. But it's like, but then they can't share information, and they don't share information. So a few years ago, when I was, I'd had elective surgery. So therefore I had follow-ups, right? That included blood tests. And my GP wanted to monitor me, and so did the hospital that did the surgery, right? But they were both in different NHS trusts. So if one of them did blood tests, the other one couldn't see the results because different system, right? Now, my GP, whenever she did a blood test, well, she didn't do it personally, but her surgery did a blood test, she would offer to print out the results so that I could, so when the hospital wanted it, I could say, well, I've just had a blood test done, here are the results. Because they were testing, it's not just that they were for the same things. They were both looking for the same things. But they wouldn't do that. So on like a couple of occasions, I had 2 blood tests inside a week, in the same week, for the same thing. That is inefficient. That means you've got 2 sets of phlebotomists or nurses taking the blood. You've got 2 sets of people like delivering it to the labs. You've got 2 sets of pathologists doing the blood test, and then maybe they put it on the system, or maybe it's someone and an admin clerk or someone inputting it. But you've got two groups of workers doing the job of one, which is mad. So to my mind, you could deal with that and immediately get a boost in productivity. But there are other things as well. But some of the things that it points out, before I get onto some comments here, one is that there's been an increase in the relative amount of funding for secondary care, hospitals basically, but because they've been asked to deal with things that aren't really what they're set up for, it hasn't actually resulted in any increase in productivity. Whereas the argument is where the primary care, which has been starved of relative funding, has come up with a lot of innovative ways to work more efficiently. It's, if you want to work on prevention as well, and that's one of Wes Streeting's big, he has these 3 things, right? The one that's most easily understood is shifting the focus from reactive treatment to prevention. Because if you can prevent these things, obviously that's always cheaper and better. And you certainly don't get complications from never having developed the illness in the first place. But where do you need to then shift that? Primary and community care as well. So there's an argument for shifting more of the funding, relative funding, to primary and community care to deliver on that. And then you're not overloading the hospital with a load of things that they're not really supposed to deal with. I remember, I don't know how many people remember this, a few years ago, Theresa May was Prime Minister at the time. And what she did is she slashed social care funding and then said, so this funding I'm removing, the NHS are going to deliver that and I'm going to give funding to them. But she didn't give the funding to them. She gave some of the funding she'd slashed. So she slashed social care funding by a certain amount for something that they were geared up to deal with, and then got the NHS, who were not geared up to deal with it, some of the money. And then do you know what she did? She had the nerve to say she'd boosted NHS funding when she hadn't. She'd actually given the NHS extra jobs for doing less. For doing more work, but she gave them less money for doing it. And, and it was, so it's things like this that have loaded pressure on the NHS. Michael there saying, depends on reason, Phil. Sometimes the difference in results in a few days is significant. If it's that they didn't order a test or made some other mistake, the point is fair. No, we're talking about routine, just checkups, really, that took place every couple of months after my surgery for like a year. G Whistler there saying, I simply don't trust or like Streeting. Moreover, he's receiving funding from private healthcare providers. See, he's not my first choice as health secretary, as some of you may know as well. But at the end of the day, it's never a good idea to like or trust any politician. I will always say that. And it just needs to be judged on results. So at the end of the day, it needs to be judged on results. And one of the good things One of the reasons why, I mean, there are multiple reasons why the NHS is always Labour's biggest project, always, whenever they're in government. Part of the reason, of course, is because it's the thing that most supporters of Labour, not just Labour members, but most supporters of Labour are most associate in terms of benefits of Labour. It's like their proudest achievement, they often say. Then there's the fact that it's actually really easy to measure. So I've got beside me here, or just slightly behind me, this is from the report. It's like, it's a great combination of waiting lists and waiting times. I always say, waiting lists are a really good metric just for showing the state of the NHS in many cases. But the size of waiting lists actually is less important than waiting times. Because it doesn't matter how long the list is. What matters to people really is how long does, and it matters to the rest of us, how long does it take to get the treatment? So you've got here, it shows that overall waiting lists have, of course, massively ballooned under the Tories. But where you've got these bands above, these different coloured bands, that's for different times. So that red one, I'm going to have to read it actually on another thing because I've made it's too fuzzy there. So that red sort of burgundy one is waits from 25 to 6 months to 12 months waiting times. And then the orange is above a year. So you can see way back when in 2010, the orange, you couldn't even really see it. Labour had got rid of it. And then now it's noticeable again. This is wait over a year. But even the burgundy, this is a wait between 6 and 12 months, during which time your condition can worsen and you develop more complications, which also then need treating. Anyway, sorry, there was a super chat up there from, is that a radiographer? Yes, Phil Spicer, £5 super chat, thank you. It says, radiographer, I see people with duplication of the same CT scans and x-rays, private sector and say in my hospital, unnecessary doses of radiation. I mean, there's that as well. I mean, in fact, in terms of scanning, let me give you another slightly personal thing. One of my stepdaughters, right, was in hospital recently, severe pain, abdominal pain. So check for the usual thing. It's not appendicitis. They did like an ultrasound of something. I can't remember what now, but I think they were probably looking for kidney stones. So they did an ultrasound, right? And they got, I'm trying to think what it was an ultrasound of. Must have been the kidney, right? But they got a bowel surgeon to look at it, but they didn't find anything. But then what they did, because they hadn't diagnosed the problem, they didn't think, right, so let's look for this or let's look for this. They just she was in hospital for like a week, right? They also lied about her because when, my wife, her mother was in, they said, you're not going to discharge her until you found it. Oh, no. They already had her discharge papers ready. When my wife left, they discharged her straight away because they were picking on the fact she's a young lady who's in pain and not very good at arguing. No, it's not gallstones. I'll tell you what it was. But here's where I'm going to go about the related to Phil with the scan, right? So basically, they refused to investigate any further. She was in massive amounts of pain, huge amounts of pain. They were also giving her the wrong painkillers for it. They were giving her something, like giving her something for, I can't remember what it was now. And it was actually making her worse. So they're giving her this thing late in the evening, and it was making her worse, so she was up all night. Anyway, it was a right mess. It was not a good advert for this particular hospital in Sheffield. And but the most important thing for me is they refused to do any more investigative scans to try and find what it was. So she did her own research. This young lady, right, who doesn't have any medical training, did her own research for what it might have been. We got her to have a private scan the 2 days after she was discharged. They found it. So if this young girl just browsing the NHS website can think of a scan to do that might identify it, and then we get it done privately and we identify the problem, she's been diagnosed with like PCOS, right? Basically what was happening is little cysts around her ovaries were exploding, which is obviously why she was in a great deal of pain. And you just think, why was that not done? So there's huge levels of inefficiency in the NHS for one reason or another. So when people say, well, it needs more funding for this and more funding for that, and and yes, that will always fix it. But when we're in a situation where we're going, well, there's not going to be that much extra funding, you inevitably have to look at ways of redistributing the funding. And there are always, I know politicians are really good at talking about waste, but there are always cases of waste. Like I always say of teaching, one of the big, when Labour were last in power, do you know what? Cannot fault the amount of funding that went into education. There was all of a sudden a huge increase in funding. We got a lot of really good stuff out of it, and a lot of it was really well spent, and it was fantastic. But there were some things that were gimmicks. Interactive whiteboards were the very worst of them. The projectors, brilliant. Like OHPs were crap, right? They were useful for some physics experiments, so I did technically secretly miss them. But as for what their main purpose was, they were rubbish, right? They were bulky, they were in your way, they weren't good. The RGB projectors linked to the PC, fantastic, brilliant. But the interactive whiteboard, I know hardly any teachers that use them. I know few, hardly any. But they cost a fortune, waste of money. Anyway, Graham's just pointing out there in part of the report, A&E is in an awful state. Long waits like to cause an additional 14,000 more deaths a year, according to the Royal College of Emergency Medicine. I think there were a couple of other things noted as well in terms of key takeaways from the report. I'll tell you one thing that was in the report, which is absolutely shocking, is in terms of cancer detection. Now, obviously, any modern healthcare system needs to be, the earlier you can detect cancer, the better. It means easier treatment. It means better outcomes. It's just better all round. It's better for the financing of the NHS, better for the pressure on the NHS, better for the patient, better for the economy, better for society, right? Earlier detection of cancer, absolutely one of the top priorities. And the report said that we made absolutely zero progress on early detection of cancer between 2013 and 2021. And I'm guessing that up to 2021 is because that's what we've got the available data for to compare with other countries, because he said this is not normal internationally. We've fallen behind other countries in terms of early detection of cancer because we made, over that 8-year period, zero progress. And that is ultimately that will be a result, Johnny Copperhead there, for the interactive whiteboards. That will be a result of the fact that what the Conservatives always do is they spend the minimum. It's like to get everything. It's a bit like with the pandemic. We know we didn't have enough PPE stockpiled for an emergency. Boris Johnson was told this in 2019. He didn't care. Because why would you spend money on something that might not happen? So then when the emergency did happen, COVID, we didn't have enough PPE. And then they delayed even further getting it. But, we should have had more stockpiles. And the Conservatives always have this attitude. They spend what they think is the bare minimum. They spend the bare minimum. So they're obviously not going to fund research and development to improve outcomes for later on. Everything with them is a short-term attitude to spending. Really short-term attitude. So Viv there said, I went to Bath Hospital recently expecting hell in A&E. They were brilliant. Hospitals do vary, departments vary. Well, even the same hospital varies, right? The same hospital that with one of my other stepdaughters, like local to me, was sent there for a scan, right? When she got there, the doctor there said, oh, you don't need this scan, and basically kicked her out of the hospital. She was we found her wandering the street. She was delirious with pain, and they actually let her out. But the same hospital diagnosed for me, when I just basically presented them with a headache and a sort of protruding vein, they treated it seriously, did all the tests on me, and then diagnosed like a sort of a temporal arteritis, for which I was given instant treatment. So, you can have different experiences in the same hospital even. But the fact that anyone is getting poor treatment at all is not, and it doesn't really matter what the cause is or whose fault it is. It means it's obviously bad for the people who are getting the poor treatment, but it's bad for everything else because it's bad for everyone. because if people are not getting the treatment they need, that means they're economically less active. Stepdaughter of mine, for example, who, as a result of it, had to take a year out of university, to try and deal with these problems, which haven't actually been dealt with. Because another problem they have is every time she goes to someone who then takes it seriously, they don't seem to have the notes from previous investigations. So she keeps having to tell them what's happened and what the results were. Why can't they just bring up her medical history? She's given them permission. Like that's the nonsense of it. That a consultant trying to investigate, if you've had like 15 years of different doctors trying to do different investigations, why don't they have that? They should have that. And in some places I suppose they would, but they don't in her case. So, and that is bad for everyone, because it means that people are, she's going to be a year later going into the world of work now as a vet if she qualifies. And if she was in work, she'd be taking time off work for these problems, and she will, until the NHS actually properly diagnose what's wrong with her. She is going to be facing a future where she's going to have to keep taking. Mentioned there gender discrimination. It is that. It's not conscious, of course. It's not conscious gender discrimination. But we know, Parliament's actually reported on it. When you've got problems particularly affecting women, like endometriosis or something like that, the time it takes to diagnose is massively out of proportion to things that also affect blokes, right? It's absolutely insane. But things like that mean you've got people who are not as productive. Because if you're having to wait longer for a diagnosis, you're ill. And again, if you allow an illness to deteriorate, you get, in fact, S-Fact just said there, to be honest, it sounds like gender discrimination. Pain of a woman is not treated as serious as pain of men. Yeah, and I think specifically when it's younger women as well, because it's almost like, oh, you just can't deal with your menstrual cycle or something. And it's like, what? Can you just, because that's, in fact, my wife keeps saying the reason why I was probably treated really quickly and taken seriously is because you've got a penis. And I said, well, they don't know that. They didn't actually scan for that. But I take her point. Because it was really bizarre that the same hospital, I go in with a headache. I've got a headache. Oh, we'd better do a load of scans and blood tests on you. And it was a bit more than that, admittedly. But that was essentially what I went to them with. I've got this headache. It won't go away. Oh, well, we'd better do some blood tests and a CT scan on you then. Someone goes in pain to the point where they're delirious. Oh, you don't need a scan. You just need to go home. And it's utterly ridiculous. And that needs dealing with. And that is one of the things that comes in the report. It actually highlights those with the worst outcomes are those with learning difficulties, which can easily make sense because, if you have learning difficulties, then you are going to have more difficulty, obviously, understanding what's the best place to access. Because the way I often feel that the NHS is designed to work at the moment, being so stretched, is it's almost like trying to get rid of people as soon as possible. But then it highlights certain ethnicities as well. So there's going to have to be, and it sounds like there will be with this report, there's going to have to be an understanding of which people suffer worse outcomes and why, and fixing that. Because if you're going to improve outcomes, if you're going to reduce waiting lists and waiting times, you need to it's not just a case of dealing with people quickly, you need to deal with them effectively. Otherwise, they're just going to keep coming back, because if you don't solve the problem, only so many things heal themselves. And then we've got the other problem, of course, at the moment, which I haven't seen in the report. I didn't actually maybe I should do a search for it, which is at the moment the vexed issue of what they're bloody called again. Physician associates. Basically, now it's not that physician associates shouldn't exist. There are absolutely jobs you can give to someone with less training to do. That's fine. The problem is when you're getting them to do the job of a doctor, when they don't have the training of a doctor, and when you're being you're being, evasive about it when people are asking about it. Like, for example, take blood tests, for example. So when I was in hospital and I had to have a blood test, a doctor took a blood test for me, right? Now, I've had quite a few blood tests over the last few years. And she said, "Oh, there's going to be bruising." And I thought to myself, and I actually said to her, "I don't normally get bruising. Oh, there's going to be bruising." And do you know what? She was right. My arm was bruised to buggery the next day. And I've had several blood tests since from people who do them day in, day out, no bruising. And so there are some things that, some tasks that a doctor might do that they probably shouldn't, that you can train someone to do. And physician associates, the concept of them is fine. What's not fine is when you get someone with like a 2-year easier course to do, that they're doing things like diagnosis and prescriptions. That's where it's not fine. Nova there, £2 super chat, thank you. It says, took my wife to A&E with stroke symptoms, 12-hour wait. That is the other problem, of course. And there will be a lot of people in A&E who shouldn't be in A&E, but because where they try to access support, they don't have the capacity. They send them to A&E. I've had that in the past, where I've contacted my GP and they've said, well, you need seen by someone, but we don't have the capacity. We can't see you quickly enough, so you'll have to go to A&E. So we have that, that happens. And it means that the people who do need to be in A&E, I mean, there is triage there, of course. You are triaged, but it does mean that you're going to end up waiting much longer. There's been there was a case reported in the news relatively recent where someone was found dead in an A&E waiting room, which is horrendous, absolutely horrendous. But so what I'm saying is there are a lot of inefficiencies. There are things you can do. If there are some jobs that doctors are doing that you can give a 2-year training course for someone else to do at lower cost because they won't be paid as much, okay, that's fine. The problem is when you start to get them to do more. I will liken it to my experience, which is education, the profession I was before I became an internet gobshite, and teaching assistants. Teaching assistants, absolutely marvelous. The problem was when the Conservatives were in power, you started to have this thing creeping in. Teaching assistants not supposed to deliver lessons, they're not teachers. They're supposed to support some kids in a class. So what started to happen is it started to creep in. First of all, they were supporting more kids than they were supposed to, right? They were overloading the teaching assistants. Then they started to take some kids out and do smaller sessions with them. Well, that's teaching, because then they're not supporting kids in a class with a teacher delivering the lesson. Then they're taking kids out of that class into a smaller room and effectively being teachers themselves. And that is the concern with these physician associates, I think, on the part of, the medical industry, the medical profession. I think there's a lot of argy-bargy at the moment with the General Medical Council, because there's a lot of doctors going, that they don't seem to be being totally honest about the impact of this either. But there we go. Gary, I won't go to A&E anymore. The waiting times are too long. Well, unfortunately, there's sometimes when you have to go. See, Mike, so not to sound like a cynic, but so many people feel entitled to call an ambulance for non-emergencies. I only know this is an ex-works as EMT training paramedic for NHS. I'm sure that's the case as well. I mean, obviously we've not had to do that. But the other issue is, even when you get there, it doesn't matter how you get there, whether you get there under your own steam or call an ambulance, you've still got this huge waiting list in A&E in itself. A lot of the times, not at all times. But you can. I mean, when I did go in for my thing, and I just, I had a CT scan relatively quickly, but that found nothing. Apparently, though, I should have had an ultrasound scan. So even then there's an issue of, because even the NHS's own entry for this condition says ultrasound, not CT scan. So I don't know, was it just that the CT scan was available and the ultrasound was not? I don't know. But it was the blood test I was in there for 7 hours for. 7 hours, and it was the last result. They were just about getting ready to discharge me with some heavy painkillers to deal with the headache, when the final result came and it's like, oh yeah, arteritis. But I was in there for 7 hours, and that was of a Sunday evening. So not terrible, but still pretty bad. But there are sometimes you can go in, and we know Friday or Saturday nights are going to be really bad, because you've got people with lots of alcohol-related problems that they end up going into A&E for. And then you've got people who just happen to be unlucky enough to present symptoms of a Friday or Saturday evening. But there it is. And Mike there saying, what are you going to do? 2-week wait for a GP appointment or 12-hour wait in A&E? And that's exactly it. For some things that GPs should be able to deliver and they can't. And that's why, again, one of the things in the report is saying we need more funding for primary care, which is GPs, and community care, and less for hospitals but then I will just leave you with the final problem though, because one problem that's been pointed out, and it's really easy to say things like Wes Street and say want to shift the focus onto prevention. And you go, yeah, can absolutely see that. If you prevent more injuries and illnesses, then you're going to end up with less pressure on the NHS, and then that will mean better outcomes for everyone else. Totally get that, but it takes time to shift to it. And then you say, and you can quite understand how if you increase the funding for GPs and community care projects, that will also improve things. You get that as well. And here's the question that's being asked. When you reform a system, anything to do with the NHS or anything else, but you reform a system, so you need to fund the new system, right? You need to put more funding into the new system, but you still have to fund the old system, because until you've fully implemented these reforms, you've still got people being sent to hospital unnecessarily. So you still have to provide the funding for that. And here's where the problem is, and I don't know what Labour are going to do about this. In the short term, it's like there's no more money. And yet in the short term, but you want these reforms. So is there going to be more money for the NHS, even though there's no money overall? Is there going to be more money for the NHS to deliver these reforms? Because it's like any new system, you have to deliver it in parallel with the old system until it's fully online and working. And if you don't do that, and this is where, as I say, Labour can't even play fast and loose. Like there are some things where governments can make a right hash of something and most of the public don't notice. Say criminal justice, for example. The Tories were allowed to build up this massive backlog of cases, and people even now don't even really know about it because most people do not ever engage with the criminal justice system. Whereas people do engage with the NHS, like even if at any one time you are not ill, you probably know someone who has needed NHS care. At any one time, most of us probably know someone who needs the NHS. So we sort of have a pretty good idea about how it's performing. Whereas very few of us will find ourselves being charged with a crime or know someone who is. And so we tend not to have, as a society, we tend not to have as good a view of the criminal justice system. But I'll leave you with that thought anyway. There's lots and lots we could talk about. The report is absolutely massive. It is published now on the government website. But yes, don't forget to click the like button. Don't forget to subscribe for further content as well. Have a great rest of day. And until next time, I will see you later.